The very first thing when you find out, that's the scariest time. Understanding how you're going to attack this as a couple and as an individual. I'm the Ditch Witch franchise for 2 states. We have about 65 employees, and we're feeding 65 families. I'm Gary Bridwell. I was diagnosed with prostate cancer in the end of December of 2010. That morning was difficult because I had gone over with my family over the weekend. You know, we're a small family-owned company, so it's a pretty tight-knit group of guys. Morning, guys. Morning. Good. And then I felt like I needed to share with my family here at work what we were facing.
We've been married, it'll be 16 years this coming summer. We met at the grocery store. I spoke first, and I was widowed. I lost my first husband to pancreatic cancer 24 years ago, and it really takes a special person to want to step in with a widow, and Gary was brave enough to do that. Our extended families are extremely close. They adore Gary. He has been adopted by all of them. It's one of those things that I think probably now Gary gets it when I used to say to him, just be patient, you know, live each day, all of that. Unfortunately, he had to walk through the shoes that we had to walk through with my brain tumor and his prostate cancer, but I think until you go through something like that, it's hard to really understand all of that. But he's just been an amazing husband.
The initial diagnosis, when you find that out, you're just petrified. It's so scary. And to have someone like... You just, it brings you to your knees. And I think that's pretty normal. No matter how big and burly you are, you can't fight the cancer because it's an unknown.
The route that we went is that we talked to a lot of people, patients, people that had gone through surgery, robotic surgery. We talked to people that had had brachytherapy. We talked to the practitioners who did brachytherapy. We talked to the practitioners that did standard radiation. We talked to a surgeon who himself had had surgery, because that's kind of surgeons think, you know, everybody, they each kind of lean towards whatever it is that their expertise is. I had met Dr. Chioli about another situation previously. I actually talked to him first by phone, and what I was most impressed with on the phone was that as I asked him about different types of therapy, he gave pros and cons. He didn't just say, oh no, you don't want to do that. I mean, he was very forthright.
And his initial comment was, hey, you're a good candidate for any option you choose because of my age and the Gleason score and overall health. We were looking at a clinical study. Mary Ellen, having experience in that area, went back and actually looked at those studies, and we got a level of comfort that the proton therapy was a pretty high percentage of survival and non-reoccurring issues. So, we proved it to ourselves by reading the clinical studies. I think unusually I had the same time for all 44 treatments. It was at 9:30. They asked you to drink a couple of bottles of water 30 to 45 minutes before your treatment. So I would have my 2 bottles in my truck and head out to ProCure and drink those bottles of water by the time I got there. go in, check in with the treatment. It takes longer to set up than it actually does to do it. Once you got on the table and all set up, they do the treatment. It takes a minute, minute and a half, 2 minutes, something like that. And then I would go back to work. I mean, I did that just about every day. There were a few days, I guess I'll have to admit, that Derek and I probably would sneak off and go play golf in the afternoon instead of going back to work. There are guys I play golf with every Saturday.
Attaboy.
Very supportive, all about my age, but just great friends. They're every day encouraging me, just texting, emailing, phone calls, encouraging me to keep going and come out and hang out with them. Just what friends do.
Good shot.
They were full of questions. Basically, none of them had faced any of that, and some of them were doing a screening, and some of them weren't. But I think probably 100% of them are doing the screening now. So, that was a good thing.
It's amazing how fast the news travels, and then how they'll quietly seek you out. You become a resource, and I think that's empowering too. That you help fill in the gaps for someone.
I've played golf a long time. Enjoy it. It's a great sport. You can play all your life.
And you can play golf while you're going through proton therapy.
Yeah, that's exactly right.
Let me tell you, there were some days that he did not go back to the office, but it wasn't because he didn't feel well. It was because he made some friends out at the Proton Center, found out they played golf. It was all over but the shouting.
Well, my employees were great because they were always trying to, what they felt like, maybe compensate for me, try to take tasks away that they felt like they could help me with, do things that they could do to help us in the company and not be a burden on me. And that was a great feeling, a great teamwork thing.
Early on, one of the things he said is, I don't want anyone to know. I don't want anyone to know. And I thought about that, and I said, well, let's just kind of think about that. But I said, Gary, 98% of your employees are men. We don't know why this happened to you or why it happened now, but I firmly believe that God positions us in different places at different times in our life. And I felt very strongly that when Gary was ready, that he really had an opportunity to perhaps save other lives, to and at least educate his employees on the importance of PSA tests, the digital rectal exam, all of that goes with finding out whether or not you have prostate cancer. And I was really proud that he went forward and he told, because it's a personal thing too.
When you first find out, it's a real personal thing, and it's all about education. And Mary Ellen's right. We've had the opportunity to talk to 20, 25 guys, just tonight. The opportunity to educate someone and give them information that can save their life or help them make the right choice and for them. And I think that urologists would tell you that most people are very guarded in what they will say, not necessarily tell the truth on what side effects or things they're facing, and they just adapt their lifestyle to it. With me, I have absolutely no side effects. I don't know if that's with everybody, but for me, I am back to 100% where I was, and I'm thankful for that. And I think the fact that I chose Proton at the time, my age, and the therapy itself has given me that opportunity to be the same. So when people ask me, would I do it again? My answer is yes, 100 times out of 100 times.